Borderline personality disorder is a condition characterized first and foremost by extreme emotional instability, with severe mood swings that typically will only persist for a few hours at a time. The term borderline refers to the fact that its symptoms are usually of intermediate intensity, but it might help you to remember the condition if you think of a person suffering from this disorder as always being on the border or on the verge of another mood swing. And actually, in its early stages, the term borderline was typically assigned to people who clearly exhibited pathological symptoms but didn't seem to neatly fit into any of the other personality disorders. In fact, there's been some debate over whether or not borderline is even the most appropriate term for this disorder. Some psychologists have suggested that ambivalent, impulsive, or even cycloid personality disorder might be more appropriate. But all labels aside, the DSM describes this personality type as extremely moody, sometimes ecstatic 1 minute and then depressed, hopeless, or even self-destructive the next. A person suffering from borderline personality disorder also shows a high level of inconsistency in their work and personal relationships. They might exhibit poor judgment, show an inability to follow through with their goals, and even though a lot of times these people are very talented and show the potential to succeed, they rarely do because they always get in their own way, they create obstacles for themselves, and they hardly ever seem to learn from their mistakes. They also lack a strong sense of identity. They're usually terrified of being alone, and they oftentimes experience contradictory feelings toward other people, meaning that sometimes they might love someone and admire them, and then within a matter of a few hours they may come to despise them. So how does this type of disorder come about? Well, researchers have found that people suffering from borderline personality disorder often come from abusive upbringings or were abandoned by caregivers at a young age. And they've also found that the parts of the brain responsible for regulating aggression and emotion, such as the amygdala and the prefrontal cortex, might also play a role in this disorder. People suffering from borderline personality disorder might be given mood stabilizers, antidepressants, or even antipsychotic drugs to combat individual symptoms, but otherwise they undergo both individual and group psychotherapy. So remember the chief characteristics of borderline personality disorder: mood instability, inconsistency in personal relationships and work, an inability to carry out goals or learn from mistakes, a lack of self-confidence and personal identity, and contradictory feelings toward others.